Hi, I'm Ashley Robertson. I'm going to be your student physical therapist today. I have on the sheet that you're Valerie Robertson. Is there anything else that you'd prefer to be called?
You could just call me Valerie.
Okay. We'll go ahead and get you back here in our examination room, and then I'll ask you a couple questions and kind of see where you're at with things. I have on my referral that you have some shoulder pain, but it didn't say much else. So why did you decide to come to physical therapy today?
My doctor recommended it. I've been having trouble with my shoulder over the last several months. It's getting worse and I can't use it anymore and I can't sleep.
Okay. I'm going to go ahead and you'll see me writing things down just so I can remember things and make sure I get a clear picture. And you said it's been happening over the last several months.
That's right.
Did it kind of just happen gradually, or was there like a moment where you did something and that's when it started? It started happening pretty acutely.
No, I don't remember any injury. I just know that from time to time I've had pain in it. It usually goes away, but this pain is getting worse and worse. And I have trouble lifting or using my right arm.
And is it just on the right side?
Yes.
So nothing's going on the left side?
No, I'm not aware of any problems on the left.
Okay. Well, I reviewed a little bit in your medical history, and it didn't seem like anything was standing out too much. You did mention some medications that you used to be on, but you're not on anymore. Is that correct?
Yeah, I don't take any regular prescription medications.
Okay, sounds good. And is there anything else in your medical history we should know about?
No.
Okay. Um, so you said you've been having most of your pain and problems with lifting and using your arm above the head?
Yeah, I can hardly reach for a glass out of the cabinet or do my hair. It's hard to get dressed.
And your pain level, is it more aggravated with doing things? So like when you're just sitting around, it's not too painful. It's just when you're actively doing things.
Yeah, it's more of a sharp pain when I try to do something.
So what would you say that your pain is right now, just sitting here talking with me?
Um, a like on a scale of 1 to 10, I'd say less than a 3.
And then throughout this last week, what would you say the worst has been?
A 7. But I did have a shot by the doctor, so it's been much better since then. Before the shot with the doctor, it was at times a 10.
Okay. Now, when you went to see a doctor, did they do any imaging or any x-rays or anything to see if anything was going on?
Yeah, the doctor did an x-ray, which he had before the injections, and then based on our last visit, he ordered an MRI.
And did he get the results back from the MRI, or is he still waiting for it?
I think the results, I've had the report, so he was looking for a rotator cuff tear, and the good news is the MRI says there's no tear.
Well, that's good to know. So then he's not quite recommending surgery or anything like that then?
I actually haven't had a follow-up visit with him since then,
Okay.
so I'm not sure.
Okay.
He wanted to try physical therapy first.
Sounds like a good doctor. Did they find anything on your x-ray, like any arthritis or anything else?
Something about bony spurs at the glenohumeral joint and at the AC joint. And the spurring on the humerus made the doctor think probably I had a rotator cuff tear.
Okay. So as far as making goals and focusing on different things that we wanted to look at with your shoulder as we get into our physical therapy plan. I'm just kind of wondering, what are your top priorities here? Is it more to manage the pain or to get you moving and get that range of motion back? Or
I'd like to be able to use my right arm again for all the things that I do every day.
and so what are some of those activities that have been
I'd like
most
to be able to
difficult?
I'd like to be able to put dishes up and down from the cupboard. I'd like to be able to reach to wipe something or put my seatbelt on. I'd like to be able to do my hair without pain.
And what do you do for work?
I'm a physical therapist.
So you're going to have lots of pain then working with patients.
Yeah, it's not bad if my arm is below the waist, but pushing and pulling, lifting and reaching is hard.
Okay. Are there any extracurricular activities that you like to do that have been completely stopped with using your arm, like playing piano or doing different kind of activities?
I can't go out and work in the yard.
Yard work. Okay. And then as far as your living situation goes, does anyone live with you that can be of assistance to you while you're having a hard time with these activities?
Yeah, I just use my other arm and do less. And my husband and my daughter do the yard work.
All right. Well, then I'll just go ahead and kind of give you a little summary based off what I have, and at the end of it, you let me know if there's anything that I missed out that you want to have addressed. But you have had several months of pain where it's just gradually increased and gotten worse. You've seen a doctor and gotten an X-ray and MRI. The MRI didn't show a rotator cuff tear, but the X-ray did show some bony spurs at the glenohumeral joint and the AC joint. And you have a lot of pain with reaching, doing hair, dishes, getting dressed. Usually it stays out about a 3, but when you aggravate it, it's about a 7. You had an injection and things have gotten a little bit better since then.
Well, I would clarify, at rest I'm about a 3. Anytime I move it, it gets up to a 7.
Yeah.
So I would just say it's that painful with movement, not necessarily because it's aggravated.
Okay, with movement specifically. And then as far as that, your goals are just kind of get back to daily living where you can do dishes and chores and yard work and be able to function with daily hygiene as pain-free and done as possible. Is that correct?
Correct.
Perfect. Well, I'll just go ahead and let you know how the rest of the examination is going to go, and then we'll get to it. But we'll check some different range of motion between both of your arms so we can see the difference from side to side and see what we're lacking and what we can work on. And then I also want to test some different muscles and see the strength in each particular muscle, see if there's one in particular that we're having a harder time with, and we'll go from there and set up a plan of how we can address these issues and meet these goals. Does that sound good?
Sounds all right.
Perfect.